Hello everyone. Welcome to my channel. My name is Jordia. I am Filipino-American registered nurse. OFW, a traveler, and founder of Care to Heal. In this video we will talk about the cardinal vital signs that defines the majority of the nursing basic assessment. This video is brought to you by Care to Heal. Please support my channel so that I can continue creating educational videos like this. Kindly like and subscribe below. So, the subjective and objective assessments play an important role in initiating, planning, and managing a patient's medical condition and treatment. The connection between vital signs and a person's overall health will yield a much better picture of their medical condition and more stable daily living. So, what are the difference between subjective and objective assessments? Subjective assessments are information obtained based on verbalization or interpretation of the patient. These assessments are not verifiable. Example, a patient stated that she or he is in pain, while the objective assessments are verifiable facts and observations. It is usually the final confirmation to diagnose any illness. Objective assessments are being used in making medical decisions to initiate treatments. Example, diagnostic testing such as X-ray, scans, laboratory works, and the first 4 cardinal vital signs. Main cardinal vital signs. Body temperature, measured by a thermometer. Normal range body temperature for an adult is 97 to 98.6 degrees Fahrenheit, 36.1 to 37 degrees Celsius, and for neonates between 96.8 to 99.5 degrees Fahrenheit, 36 to 37.5 degrees Celsius. A body temperature over 100.1 degrees Fahrenheit, 38 degrees Celsius, is considered febrile, indicating that a patient is with a fever due to possible infection or illness. The most accurate home method is the oral route. Place the thermometer under your tongue and close your mouth. Wait for the beep or the recommended amount of time. Rectal, axillary, under the arm, and tympanic, ear, measurements are other options. Frequency, as needed, when feeling feverish or ill. Pulse or heart rate, measured using stethoscope or by a cardiac monitor. In general, when at rest, the lower heart rate, the better. It indicates that the heart function are efficient. Resting normal heart rate for adult ranges from 60 to 100 bpm, beats per minute, and for neonates 120 to 180 bpm. Low pulse rate indicates low blood oxygen levels in the body and possible heart disease. High pulse rate will prevent the body from breathing adequately, and heart rate more than 150 bpm indicates heart disease that requires immediate medical attention. Heart rate can be affected by multiple factors such as illnesses and environment status, humidity, cold, and heat. Place 2 fingers, index and middle, on your wrist, on the side of your thumb. Count the beats for 60 seconds for an accurate measure. Ensure you're relaxed and have not been active immediately before. Frequency, daily or as recommended by your healthcare provider. Respiration rate, measured using stethoscope or by chest movement observations. https://amazon.de/49earth. Resting normal respiration rate for adults is between 12-16 bpm, breaths per minute, and for neonates 40 to 60 bpm. Low respiration rate associated with symptoms indicates low oxygenation level in the blood and possible intoxication. High respiration rate indicates respiratory distress, shortness of breath, and difficulty of breathing. Count how many times your chest rises in 1 minute. It's best done when you're relaxed, perhaps lying down and not immediately after physical activity. Frequency, as needed, especially if you're monitoring conditions like asthma or COPD. Blood pressure, measured using stethoscope and blood pressure machine. Resting normal blood pressure for adult 90/60ths of a millimeter of mercury to 120/80ths of a millimeter of mercury, for neonates 60/30ths of a millimeter of mercury to 80/45ths of a millimeter of mercury. Low blood pressure indicates dehydration, shock, and infection. Blood pressures 140/90ths of a millimeter of mercury and above for adult may indicate stroke and other illnesses that requires immediate medical attention. Sit in a comfortable position, with your arm rested at heart level. Wrap the cuff around your upper arm and follow the machine's instructions. It's best to take your blood pressure at the same times each day. Frequency, as advised by your healthcare provider, often once daily or more if recommended. Oxygen saturation, SPO2 tools needed. Pulse oximeter. Method: clip the device on your fingertip and wait a few seconds for it to display your oxygen saturation level and heart rate. Ensure your hand is warm, relaxed, and held below your heart level. Frequency, as recommended, especially useful for respiratory conditions like COPD or monitoring COVID-19 at home. Pain is considered as one of the cardinal vital signs by some sources in healthcare studies. However, it is hard to confirm this in objective assessments. Pain assessment in nursing is a crucial component of patient care, as effective pain management begins with an accurate assessment. Pain is often referred to as the fifth vital sign alongside temperature, pulse, respiration, and blood pressure, emphasizing its importance in clinical assessments. Here's a structured approach to pain assessment in nursing. Nurses should observe the patient for nonverbal signs of pain, especially in those who are unable to communicate effectively. This includes facial expressions, body movements, changes in vital signs, and behavioral changes. Assessing the impact of pain. Understanding how pain affects the patient's daily activities, sleep, mood, and overall quality of life is essential for creating an effective pain management plan. Cultural sensitivity. Be aware of cultural differences in expressing and managing pain. Some patients may underreport pain due to cultural beliefs or fear of addiction to pain medication. Reassessment and documentation. After interventions are implemented, it's important to reassess the patient's pain using the same method as the initial assessment to evaluate the effectiveness of the pain management strategies. Document all assessments, observations, interventions, and patient responses meticulously. Interdisciplinary approach. Collaboration with other healthcare professionals, including physicians, pharmacists, and physical therapists, can enhance pain management strategies and patient care. Effective pain assessment and management are pivotal in improving patient outcomes, enhancing quality of life, and facilitating recovery. Nurses play a key role in this process, acting as advocates for their patients' well-being and comfort. Tracking these cardinal vital signs can offer early warnings of medical issues that can save lives of many individuals. Knowledge and understanding these vital signs are key to medical safety and disease prevention. A resource tool for healthcare providers and non-healthcare people. There are new innovations and advanced high technology being offered nowadays to monitor vital signs wherever you are. Examples are watches and other devices linked into cell phones and more. https://amazon.de/3snlqcz. There's so many safe ways you can do to maintain and monitor your vital signs at home. One of the best method is through lifestyle choices. Stay healthy, my friend. I hope you enjoyed this video. I highly appreciate your time and comments. Kindly leave a short comment. Every comment will help me improve the content of my video. For faster delivery and medications need, please visit caretoheal.org. Thank you for watching and see you in my next video. Please click like and subscribe below.